So everyone has been so crisp, so I don't think I'll open my written notes because it'll become too long. I want to share with you a perspective which you must understand what is the policy and the research, the combination seen at a policymaker's level. I am not going to go into fundamental research and other kinds of research, literary research and all that. I'm just talking as a policymaker. See, as a policymaker, whether you're a minister guided by other bureaucrats, your job is to see that whatever policy is made is able to help the largest number of deprived people in a developing country. There are constituencies, there are lobbies, there are people who want things for themselves. It is natural. Everyone will want something from the government, but government has a responsibility. If you look at the bottom line in a developing country, the bottom line is how many people from the deprived sections have you been able to help? And that applies overwhelmingly in the health sector. In the Ayush sector within health, in the totality of health, let us look at the fact that, at least I remember, you had very strong protagonists representing education, representing drug manufacturers, representing those who were cultivating or wanted to sell medicinal plants, those who were institutions among themselves, whether it was Rashtriya Ayurveda Vidyapith or the pharmacies which were making drugs, or the industries lobby, the classical families on the one side, the patent proprietary families on the other side. And the tug of war for drug manufacturers, with due respect to Dr. Shastri, since I'm on the board of some Ayurvedic companies, I know that profit is all that matters. There's no doubt about it. R&D is only the route to be able to make profit. He admitted it. There's nothing wrong with it. That is how the world goes, and you have to be knowledgeable about that. But let me come back to what policymakers in the Indian government in the health sector are expected to do. And health policies are always paying lip service to this and doing very little about it. You have to look at the social determinants. And the social determinants, just to share with you something which is not widely known, it's in the census and it's in our paper. Dr. Kishore Patwardhan and I wrote a paper, not related to research, but still. We brought this out, it's not been contradicted by anybody. You look at the country as a whole, 67% of the population is in rural areas. Of the 67%, census shows you that 50% are in mud and thatched huts. Please take that in, mud and thatched huts. They earn through manual labor. They earn daily wages. If you look at the population, you're supposed to be able to reach out whatever you do, predominantly for those people. How much of whatever we do is even aimed at those people? Let us be frank, very, very little. It is what the lobbies demand, and governments are forced to give in to the lobbies that cry the loudest and are able to give, you might say, a feeling to the government that they have achieved something. And I'm not talking of this government, every government. Now, if you look at the fact that you want to go back there, and the fact that those people are not just falling prey to malaria and communicable diseases. They are very much falling prey to non-communicable diseases. The latest report, Dr. Katoch would know, brought out jointly by ICMR and PHFI and I think the World Bank and some others, clearly shows that the growth of NCDs, non-communicable diseases, among the rural poor, the trajectory is going faster than even in urban India. Why? Because of lifestyle, yes, the Maggi noodle culture, the sugar culture, all the things the sedentary lifestyle, and many things have affected. Those are, social reasons we needn't go into, but the fact is that epidemiological research has shown you that they are susceptible. So one is this group of people who are going to suffer from NCDs, and we are doing very little to prevent it. Second are the group of people who are somewhat well-endowed, rich, disposable income, and they are falling prey, their children are falling prey to obesity very early in life and are succumbing to all kinds of diseases. The writing is on the wall. It's only when they get all this that they are in clinics and they are with doctors. The world of Ayurveda talks so much about preventive medicine. It talks so much about whole body, about lifestyle, about diet, about even prayer, about having a happy disposition when you eat, about having a happy disposition when you bear a child. All these things are Ayurvedic concepts. Are they ever spoken of in our day-to-day dealings with people? No. They may be spoken of by an odd grandmother to a daughter or to a granddaughter, but nothing more than that. If we start lecturing like this in a school and telling people preventive medicine, believe in, dinacharya, ritucharya and all that, nobody's going to take you seriously. They just will not, because it's not packaged the way modern contemporary people want. But there is a whole lot of truth behind that. And that packaging and that marketing is not being done at all. Now let's come back to specific problems. Leave the NCDs for a minute. I'm thinking of what I am seeing among my peer group of people in my age group. Men are having benign prostate hypertrophy. They get up 3 times at night for urination. They don't want to take chemical drugs because they know there are problems attached. Somebody tells them, if you take Vijayasar, it is marvelous. There is a paper in AIIMS done by Ranjit Rai Chaudhary on the properties of Vijayasar. So you go to Khadi Gramodyog and you buy big packets of Vijayasar and you soak it in water at night and you drink it in the hope that kuch nahi hoga, harmful to nahi hai, shayad mujhe help karega. Similarly, I was telling somebody, a batchmate of mine, a retired chief secretary of Maharashtra, he takes cinnamon, dalchini, any amount, the idea being that, my blood sugar will come down with dalchini. You see, I took it, I'm much better. This is the kind of thing that the urban educated are indulging in. When they get into problems with diabetes, into hypertension, they say, bataiye koi acha ved hai? You send a person to Acha Ved and the Acha Ved will just give them medication. But that is not Ayurveda. Whole body treatment and whole body, you might say, treatment of a human being is completely different. And that has been forgotten. The disease and the pill culture is totally an allopathic approach. And we have never nurtured this. We are not even trying to nurture. Does Ayurveda have something for these conditions? You have for osteoarthritis, you go for panchakarma, you say, I can now climb stairs, I couldn't do it before, I can sit on the floor, I couldn't do it before, you come back and say, panchakarma jarur karaiye, bada acha hai. You don't know what has gone into panchakarma, you don't know anything to do with all the 16 stages and which were used on you and something else used on the other. Who has done the research in a way that these questions are answered? Nobody. If you talk to Ayurvedic people, अरे उसके पे पेपर लिखा है, हमने तो इस सेमिनार में बात की थी, हमने इस सिम्पोजियम में जाके बात की. I am unable to answer these questions as a bridge. We have no bridge to the common man who is looking, the educated common man and the uneducated. The illiterate fellow as well as the literate are looking for answers. Does Ayurveda have anything to help me for prevention, for promotion of good health? The really rich spend enormous amounts buying all kinds of products off the shelf for rejuvenation, for doing all kinds of wrinkle treatment, all kinds of slimming treatment. All of them have, this is Ayurvedic medicine written on it. Nothing more. Hardly anything has a product insert which is based on research. So I am coming back to the fact that you have the richest of the rich who are looking to Ayurveda because they think that it's a panacea. Ayurvedic medicine is selling in France. And when I realized that made in China is written and it is actually called Ayurvedic medicine, I actually wrote to Prime Minister's office at my age. I wrote to the Ayush Ministry and I begged of them. I said, President Macron is coming from France. Please take this up with him. How are they allowing this to happen? These are not questions for direct research, but they are questions which go back to what is your approach to Ayurveda. You can turn around and say, that's not my job, I'm a scientist. It's the job of the ministry to be doing all this. It's not the job of scientists to be going into what happened in France and what is being sold as Ayurveda and all. But let us now pull all these ideas that I have given you, which are based on experience, they're based on a wealth of reading, and they're based upon the fact that we have on the one hand impossible conditions being said in print, making wild claims about cure, wild claims about improvement, completely disallowed by the Drugs and Cosmetics Act and being done with impunity. On the other hand, you have people craving for information. Please tell me something. Will it help me? Does Ayurveda have something for constipation? I was asked yesterday. Does Ayurveda have something for constipation? They don't know that. All of you will immediately start off your tripala churna le lo or ye ashwagandha le lo or wo raat ko ye le lo or dahi mat khao. That's not the answer. You will have to have research to prove this. And research to prove this has to be done meticulously, not by having RCTs and placebos. Ayurveda cannot be subjected to randomized control trials, which may be the gold standard for allopathy. It cannot apply to Ayurveda, because Ayurveda, much as you standardize the medicine, is not only drug-based. It is based upon lifestyle, it's based upon food, it is based upon sleep, it is based upon metabolism. It's based upon even prayer and incantation. Can you wash all this away? So you have practitioners in Kerala, and I have a lot to do with some of them off late. I didn't know much. They are following the old traditional Kerala Ayurveda, whether it's a placebo effect or it's having any effect. Foreigners are going in droves over there. The richest people are going in droves and spending 3 weeks at a time getting that kind of Ayurvedic treatment. Are they really getting anything which improves the health, which improves the condition they are in? We do not know. There's no paper. It is just one man telling the other, "Arey main gayi thi wahan ko tekal, I had, I'm feeling much better now." This is not research. I am putting to you, you will say, what are you trying to tell people then? What do you want done? I would say, number one, it is the duty of the government, and by government I don't mean Ayush, CSIR, ICMR, Ministry of Ayush, Ministry of Health, to ensure that the pool of funds available for research are all put together. This kind of a funding, few projects from CSIR, few projects from science and technology, a few from Ayush, and everyone just running around project-wise producing something at the end of it or nothing at the end of it, is ridiculous. We should be very, very clear that the general public at large are interested in getting well and staying well. How much of your research is directed to the general public? In my view, you won't like it, but in a poor country, 70% of your funds should be going there. You should be having proper protocols made by people who know how protocols are made. And you shouldn't fight shy having with you allopathic people. If a person has markers for prostrate or markers for osteoarthritis or markers for diabetes or hypertension, well, it's very easy to see, do you have, today when you come, what were your blood markers or your pathological tests or your ultrasound tests? They will be specific to the conditions. If you're able to do whatever, let the Ayurvedic physician do whatever he wants. The next 3 months, after 3 months, again the group of people who are blind to whose study is coming will look at only the laboratory test to see if there is improvement and give a finding. That is the kind of research, it will be mind-blowing even if one paper comes in. I'm not talking about journals. Journals will be needed. And that, people in Ayurveda don't know how research, which is published research, has to be done. The rigor that is required, the kind of meticulous attention to detail, the amount of reading you have to do, that research does not exist. I just went and wrote an article for India Today on our higher education system. 4,000 journals have been thrown out by UGC. I don't know if they've even touched the Ayush journals, but 4,000 higher education journals were thrown out because they were rubbish. Why are we wasting our money on telling ourselves we're doing research? That's not research. If you're not serious about protocols, you're not serious about how you're going to conduct it, what methodology you will follow, and the point that I want to make, Ayurveda has it already going. I have visited the country, I've gone to so many hospitals, government, private, and I have seen people come over there of their volition. They're not being dragged there, they're coming because they want something. Some OPDs are heavily subscribed, some have hardly 3 or 4 people. The ones which are heavily subscribed, make a list of 100 hospitals which have a heavy subscription. That the Ayush Ministry can certainly do. After that, boil it down to how many of those come down to 5 conditions or 6. Where is Ayurveda got a strength that people are on their own seeking it? Not because they wanted to reduce the dosage of allopathic medicine, not because they want to avoid surgery, but neither of these are bad things, but also because they believe in the goodness of Ayurveda. Find out, let Poddar College, there's so many colleges all over, your Tilak Mahavidyalaya is there, your National Institute of Ayurveda is there, Gujarat Ayurvedic University, Banaras Hindu University, Ayurvedic Hindu University, all of them and the southern colleges of Kerala and all, they have got mind-blowing number of people comparatively, don't compare with allopathy, compare within Ayurveda who are going for treatment. I went to Poddar College on Gokulashtami day. Gokulashtami is a big festival in Maharashtra. And women were standing outside for treatment for their oncoming childbirth. That means there was a faith that there was getting something there. I went to a primary health center in Tamil Nadu. There was a queue of women with 8-month-old baby. They had a big stomach waiting to have oil treatment done under Siddha. All this needs to be investigated. First, look at the universe and bring it down, funnel it down to 5 or 6. Fund those people. Fund people whom you will identify in ICMR. Dr. Katoj will do it by a click of his fingers. He knows what kind of people are needed. Don't fund them for every project. Fund them for the kind of measurements they will do pre and measurements they will do post. That doesn't cost all that much money. Methodology can be written jointly by somebody in ICMR and your people who are going to fund this research or who is doing it. And find these subjects to answer 5 or 6 basic questions in 1 year. Just 5. Do you have something for benign prostate hypertrophy? You will have the world at your feet if you can stop a man who's going 3 times at night, going for urination, coming down to 2. He will be at your feet. If you are able to do something to help people to climb stairs, to sit on the floor without having knee and hip replacement surgery, or postponing it at least, they will be also at your feet. But you're not answering these questions. You're all the time saying, Ayurveda mein sab kuch hai, wo shloka mein ye likha hai, wo likha hai. Who cares about your shlokas? I'm being honest with you. I'm talking to people who have been invited. I know Bhushan would have been very discerning in whom he called. I'm not trying to provoke you and I'm not trying to annoy you. Please remember that in a poor country, and we are a poor country, whatever you may say about anything, our per capita income is nowhere near the lowest of the middle income countries. Now, with that rural population which I told you, you owe it to them. You owe it to this curious, educated public, both of them. You need questions to be answered. I do feel you have the tools to do it, but not in a house full of Ayurvedic people. You have to have people from outside to do the methodology, do the protocols, and allow the Ayurvedic practitioners to do whatever they want. If they want to stand on their heads, let them stand on their heads. At the end of it, you just measure what has come out. Whole body. Do not get into this whole business of the drug. Standardization will go on. You will need drugs. There are drugs for macular degeneration, another growing problem. If you can prove that these drugs taken over a period of 6 months were able to retard the macular degeneration from the point of view of the patient, even that is enough as a therapeutic study if you are able to put it across. So I would say sky is the limit. The diseases of today, the contemporary problems of today, it is an opportunity like never before. Please think of it in that way. Don't think of it in your own little world of, I deal with this and that's the most important thing. For a country, it is not important. What is important in a country is that the population and the larger population get relief or get the postponement of problems which are health related because you have thought it through. If sugar is a problem, you can, with Ayurveda, be able to inculcate a culture of food habits which shun the use of white sugar. It is in Ayurveda that you use good or you have other things. Make that into an Ayurvedic diet, but research it out, that it helps. I am sorry if I've taken a lot of time, been a little more passionate than I need have been. I've not referred to my notes because it would have been very boring. But at the end of it, I want to only say one thing. We also, and Dr. Nisari is here, I think we also need an institute which will continuously do research into the educational patterns of India in Ayush. The South is doing a completely different kind of Ayurveda from North. They are not fiddling around and doing both allopathy and Ayurveda. And the way they are doing it and the way the public are directly going to Ayurvedic people is completely different from what is happening in the North. Now, I think the regional differences do need to be studied. The education, I hope the National Commission on Indian Systems of Medicine bill will come after the Government of India passes the other bill, which is for the Medical Commission. It's on the same lines. And if the CCIM is hopefully done away with and you have a completely new body, this is what that body should do. Set up an institute which looks at regional differences and celebrates and tries to make those regional differences into something which is special for that region, which others can emulate if they want to, rather than simply saying, hum ye karte, wo karte hain. This is not the way the common denominator beyond a small segment will not work in a country as diverse and as huge in the area of Ayurveda. It might work in allopathy, that's a totally different thing. So with those few words, thank you, Bhushan, for inviting me, giving me this opportunity, and thank you.
Thank you, ma'am. I request Rama ma'am to felicitate Shailaja ma'am. Ma'am, you did not provoke neither annoyed us, but you really oriented, directed, and inspired. Your talk was not that of an administrator or policymaker, but we could see a population scientist, public health scientist, and epidemiologist too. And hence I remember